Good morning and welcome to today's press conference. My name is Mia Rabson from the Canadian Press and I'll be moderating today. Today we have with us Dr. Supriya Sharma, the Chief Medical Advisor at Health Canada, Dr. Howard Njoo, the Deputy Chief Public Health Officer at the Public Health Agency of Canada, and Dr. Matthew Tunis, the Executive Secretary to the National Advisory Committee on Immunization. So we'll have about an hour-ish, up to an hour for statements and questions. We'll start in the room. If you are on Zoom and would like to ask a question, please use the raise hand function. Thank you.
Good morning, good afternoon. Thank you for joining us. Today I'm here to talk to you about Health Canada's authorization of the Pfizer BioNTech bivalent COVID-19 vaccine booster for people 12 years of age and older. This adapted vaccine targets the original SARS-CoV-2 virus as well as Omicron. For this reason, it is called a bivalent vaccine. Vaccines are often adapted to better match circulating variants to provide broader protection against them. This particular vaccine contains mRNA from both the original SARS-CoV-2 virus and mRNA from the Omicron BA.4 and BA.5 subvariants. This is the second bivalent COVID-19 vaccine authorized by Health Canada. On September 2nd, we authorized Moderna's BA.1 bivalent booster for people 18 years of age and older. Both of these vaccines will produce a strong immune response and are expected to provide improved protection against Omicron and its subvariants circulating in Canada. Health Canada received Pfizer-BioNTech's submission for this vaccine on September 2nd, and the submission included safety and immune response data from Pfizer-BioNTech's clinical trial for its Omicron BA.1 adapted bivalent vaccine, as well as preclinical and manufacturing data about the Omicron BA.4, BA.5 adapted bivalent vaccine. Health Canada has extensive experience with strain changes for annual influenza vaccines, and for this review, Health Canada used similar principles and processes. Preclinical data obtained from the animal studies showed that a booster dose of the BA.4, BA.5 bivalent vaccine triggered a strong immune response against Omicron subvariants BA.1, BA.2, BA.4, and BA.5, as well as the original strain of the virus. As part of our review, Health Canada also considered data on the safety and effectiveness of the original Pfizer-BioNTech COVID-19 vaccine, which has been safely administered to millions of people in Canada and around the world. The vaccine safety profile is expected to be comparable to that of the original COVID-19 vaccines, for which a large amount of data is available. It's worth noting as well that in the U.S., nearly 5 million doses of this new Pfizer-BioNTech bivalent vaccine have already been administered, and no new safety signals have emerged. As it does with all health products, Health Canada will monitor emerging real-world safety and effectiveness data on the vaccine and will take immediate regulatory action if any concerns arise. It's important to remember that vaccination continues to be one of the most effective tools that we have available to protect against COVID-19. Evidence shows that all mRNA COVID-19 vaccines authorized for use in Canada continue to be very effective at preventing severe illness, hospitalization, and death from COVID-19, regardless of variant. Keeping up to date with your COVID-19 vaccines, including getting your booster doses as recommended, will help protect you and your loved ones against serious illness and other complications from COVID-19 infection. Now that the vaccine is authorized, I'm sure everyone is anxious to hear how it will be used, and Dr. Njoo will be providing an update. Thank you. Merci. Miigwech. Et maintenant en français. Bonjour. Je vous remercie d'être de notre aujourd'hui. Je suis ici aujourd'hui pour vous parler de l'autorisation par Santé Canada de vaccins de rappel bivalents contre la COVID-19 fabriqués par Pfizer-BioNTech pour utilisation chez les personnes de 12 ans ou plus. Ce vaccin adapté cible le virus original, à savoir le SARS-CoV-2, ainsi que le variant Omicron. C'est pour cette raison que l'on parle d'un vaccin bivalent. Les vaccins sont souvent adaptés pour mieux correspondre aux variants en circulation afin d'offrir une meilleure protection contre ceux-ci. Le vaccin dont il est question aujourd'hui contient de l'ARNM du virus original, le SARS-CoV-2, et de l'ARNM de sous-variants BA.4 et BA.5 d'Omicron. Il s'agit du deuxième vaccin bivalent contre le COVID-19 à être autorisé par Santé Canada. Le 2 septembre, nous avons autorisé l'utilisation de vaccins de rappel bivalents de Moderna qui ciblent le sous-variant BA.1 chez les personnes de 18 ans ou plus. Ces deux vaccins produiront une forte réponse immunitaire et devraient offrir une meilleure protection contre le variant Omicron et ses sous-variants en circulation au Canada. Santé Canada a reçu la présentation de Pfizer-BioNTech pour ce vaccin le 2 septembre. La présentation comprenait des données sur l'innocuité et la réponse immunitaire obtenue dans l'essai clinique mené par Pfizer-BioNTech et à l'aide de vaccins bivalents adaptés aux sous-variants BA.1 d'Omicron, ainsi que des données précliniques et des fabrications de vaccins bivalents adaptés aux sous-variants BA.4, BA.5 de Omicron. Santé Canada possède une vaste expérience des changements de souche avec les vaccins annuels contre la grippe. Dans le cadre de cette évaluation, Santé Canada a utilisé des principes et des processus similaires. Des données précliniques obtenues lors d'études menées chez des animaux ont montré qu'une dose de rappel de vaccin bivalent BA4, BA5 déclenche une forte réponse immunitaire contre les sous-variants BA1, BA2, BA4 et BA5 et contre la souche originale de virus. Dans le cadre de son examen, Santé Canada a également tenu compte des données sur l'innocuité et l'efficacité du vaccin original de Pfizer-BioNTech contre la COVID-19 qui a été administré en toute sécurité à des millions de personnes au Canada et ailleurs dans le monde. Le profil d'innocuité de ce vaccin devrait être comparable à celui de vaccins originaux contre la COVID-19 pour lesquels une grande quantité de données sont disponibles. Il convient également de noter qu'aux États-Unis, près de 5 millions de doses de ce nouveau vaccin bivalent de Pfizer-BioNTech ont déjà été administrées et qu'aucun signal relatif à la sécurité n'a été identifié. Comme il le fait à l'égard de tous les produits de santé, Santé Canada surveillera les données sur l'innocuité et l'efficacité réelle du vaccin et prendra des mesures réglementaires immédiates si des préoccupations devaient surgir. Il est important de se rappeler que la vaccination demeure l'un des moyens les plus efficaces dont nous disposons pour nous protéger contre la COVID-19. Les données montrent que tous les vaccins à ARNM contre la COVID-19 dont l'utilisation a été autorisée au Canada demeurent très efficaces pour prévenir des cas graves, les hospitalisations et des décès dus à la COVID-19, et ce, quels que soient des variants en cause. En vous assurant d'être vacciné contre la COVID-19 et de recevoir des doses rappels recommandées au moment opportun, vous pourrez vous protéger et protéger vos proches contre les symptômes graves et d'autres complications de la COVID-19. Maintenant que le vaccin est autorisé, je suis certaine que tout le monde est impatient de savoir comment il sera utilisé. Le Dr. Njoo fera le point sur la situation. Merci. Thank you. Miigwech.
Good morning. Good afternoon. Today, the Public Health Agency of Canada released updated guidance on fall boosters from the National Advisory Committee on Immunization, or NACI. This update reflects Health Canada's authorization of a second bivalent COVID-19 vaccine, the Pfizer-BioNTech Comirnaty BA.4 and BA.5 vaccine. NACI recommends that people 12 years of age or over who are eligible to get a booster this fall receive a bivalent Omicron targeting vaccine. Both of the bivalent vaccines authorized for use in Canada provide good protection against Omicron. As vaccination continues to be one of the most effective ways to protect against serious illness but can wane over time, it is important for everyone to stay up to date with COVID-19 vaccinations. If it has been 6 months or more since your last vaccine dose or COVID-19 infection, it is time to get another dose. This is especially important if you are 65 years of age or older or have medical conditions that place you at high risk for severe illness from COVID-19. I am pleased to share that Canada will have enough supply of the Omicron targeting bivalent vaccines to cover the anticipated demand for fall boosters. I know that some of you have already received an original mRNA vaccine for your fall booster. Evidence continues to show that original mRNA vaccines provide good protection against serious illness and hospitalization, including from Omicron infection. If you recently received an original mRNA vaccine for your fall booster, you do not need to receive a bivalent Omicron targeting booster at this time. Additionally, as flu season approaches, I would also like to take this opportunity to remind people in Canada to get a seasonal influenza vaccine as soon as they become available. It is safe to receive both the flu and COVID-19 vaccines at the same time. Vaccination is important this fall, especially if you are at high risk for severe illness. Staying up to date on your COVID-19 vaccine and getting a seasonal flu vaccine will give you the best protection. Please contact your local public health authority or province or territory to book a vaccination appointment in your area. It is time to take action this fall. Stay healthy by getting vaccinated. Bonjour à toutes et à tous. L'Agence de la santé publique du Canada a diffusé aujourd'hui les orientations mises à jour du Comité consultatif national de l'immunisation, le CCNI, sur l'utilisation des doses de rappel à l'automne. Cette mise à jour tient compte de l'homologation par Santé Canada d'une deuxième dose bivalente contre la COVID-19. Le CCNI recommande à toutes les personnes de 12 ans et plus admissibles à une dose de rappel cet automne de recevoir une dose de rappel d'un vaccin bivalent ciblant le variant Omicron. Les deux vaccins bivalents homologués au Canada offrent une bonne protection contre Omicron. Puisque la vaccination demeure l'une des façons les plus efficaces de protéger contre les formes graves de la COVID-19, mais que son efficacité diminue au fil du temps, il est important que chaque personne parmi nous maintienne à jour sa vaccination contre la COVID-19. Si 6 mois ou plus se sont écoulés depuis votre dernière dose de vaccin contre la COVID-19 ou depuis que vous avez eu la COVID-19, il est temps d'obtenir une autre dose. C'est particulièrement important si vous avez 65 ans et plus ou si vous avez une condition médicale qui vous prédispose à un risque élevé de développer une forme grave de la COVID-19. Je suis heureux d'annoncer que le Canada aura des stocks suffisants des vaccins bivalents ciblant le variant Omicron pour répondre à la demande prévue de doses de rappel. Je sais qu'il y a des gens qui ont déjà reçu l'un des vaccins à ARNM d'origine contre la COVID-19 comme dose de rappel automnale. Les données probantes continuent d'indiquer que les vaccins à ARNM d'origine contre la COVID-19 offrent une bonne protection contre les formes graves de la COVID-19 et l'hospitalisation, y compris dans les cas d'infection par le variant Omicron. Si vous avez récemment reçu l'un des vaccins à ARNM d'origine comme dose de rappel automnale, vous n'avez pas besoin de recevoir en ce moment une dose de rappel d'un vaccin bivalent ciblant le variant Omicron. De plus, à l'approche de la saison de la grippe, je tiens aussi à profiter de l'occasion pour rappeler aux personnes au Canada d'obtenir un vaccin contre la grippe saisonnière dès qu'il sera disponible. L'administration des deux vaccins, celui contre la grippe et celui contre la COVID-19, en même temps et sans danger. La vaccination est importante cet automne, surtout si vous êtes susceptible d'être gravement malade. La vaccination contre la COVID-19 à jour et le vaccin contre la grippe saisonnière vous offriront la meilleure protection. Veuillez communiquer avec les autorités de santé publique de votre localité ou encore avec votre province ou votre territoire pour obtenir un rendez-vous de vaccination dans votre région. Le moment est venu de passer à l'action cet automne. Restez en santé en vous faisant vacciner. Merci. Thank you. Miigwech.
Okay, I guess we're ready for questions now. We'll start with questions in the room with Emily Bergeron from la Presse canadienne.
Oui, bonjour. La dernière fois qu'il y avait eu des recommandations du CCNI pour un vaccin bivalent, ça disait quand même que dans certains cas, les 12 ans et plus pouvaient recevoir une dose, par exemple, s'ils ont des conditions de santé particulières. Dans ce cas-ci, quelles sont les recommandations? Est-ce que c'est la même chose?
Bonjour, oui, c'est Dr. Njoo. Oui, je pense que pour simplifier, moi je peux dire que si on est admissible pour une dose de rappel et on est 12 ans et plus, c'est facile, ça fait déjà 6 mois ou plus après la dernière dose ou une infection de se faire vacciner avec un vaccin bivalent.
Oui, excusez-moi, j'ai mal formulé ma question. Ce que je veux dire, c'est les moins de 12 ans. Dans certains cas, pour les personnes qui ont moins de 12 ans, le CCNI recommandait, pour ce qui est du vaccin bivalent de Moderna, que dans certains cas, le vaccin peut être administré pour certaines conditions de santé. Est-ce que dans ce cas-ci, c'est la même chose? Mais c'est pas ça ma question de relance.
Non. OK, excuse. Non, je pense que c'est autorisé pour 12 ans et plus. Et pour moi, mais même avec le CCNI, on ne recommande pas pour les personnes moins de 12 ans.
OK. Vous avez insisté encore une fois sur les personnes qui ont déjà eu une dose de rappel cet automne, qui n'ont pas besoin de retourner avoir une autre dose de rappel d'un vaccin bivalent. Est-ce que vous craignez qu'il y ait quand même une ruée ou un certain mouvement et des personnes qui décident d'aller chercher tout de suite une autre dose pour avoir un vaccin bivalent cette fois-ci?
Pour moi, c'est clair que si on a déjà reçu une dose de rappel, et c'est fait pas 6 mois, c'est pas nécessaire de retourner pour une autre dose de rappel. Mais je pense que si on regarde, examine les critères des programmes de vaccination dans une province ou territoire, aussi peut-être les circonstances comme la situation épidémiologique dans une région, aussi les facteurs, les circonstances individuelles pour un patient, je pense que c'est possible pour une personne, peut-être en discutant avec un fournisseur de soins de santé aussi, selon les critères d'un programme de vaccination d'une province ou territoire, qu'on peut avoir même un intervalle jusqu'à même 3 mois. En principe, le CCNI recommande un intervalle de 6 mois, mais je pense qu'avec les autres considérations, c'est possible d'offrir une autre dose après 3 mois.
I could also add to that, Dr. Njoo. In the report, excuse me, the committee also outlines that the expectation is not that there would be a routine booster program offered every 3 months. That although in some exceptional circumstances, individuals may seek that, but that's not the routine expectation going forward. So we'll continue to see how the product environment evolves and how the epidemiology evolves, but to dispel that myth, there's not an expectation that it'll be a routine 3-month cycle.
I'm going to take the moderator's privilege and ask questions from my spot over here for now. I'm just curious, there was a lot of confusion when we approved the Moderna BA.1 about why we were doing that and not the BA.4 when that was being approved in the United States. And I think a lot of people are confused about which one to get, what's the effectiveness of both. Can you talk a little bit, like sort of telling people if they have a choice or if they don't have a choice, if they should just get still the vaccine that's offered to them that's available?
Sure. I mean, I think it's a broader question about like what to do at this stage. So I think the factors in terms of deciding what dose is right for you and when really haven't changed. So there's really 4 things. One is, when is the last time you had a dose of vaccine, right? Or your last booster, your last vaccination. Did you have COVID? And if so, when was that? What are your own personal, I'll call them biological risk factors, age, do you have other illnesses? And then what are your exposure sort of risks? And that includes, where you're working or your environment, or if you are going to be undertaking activities that potentially put you at an increased risk, like travel or weddings or something you're doing indoors. So those factors are all the things that we would consider. I think our general message is, if you are 6 months post any vaccine and COVID illness, then you should get your bivalent vaccine. You should get that booster, and that'll help you in terms of serious illness, protection, but it'll also give you some protection, especially in the short term, against potentially getting infected with COVID. There does not seem to be a significant difference between the BA.1 Moderna and the BA.4/5 Pfizer. Now, they're very similar. They're both Omicron bivalents. They will both broaden your immune protection. Moderna has a slightly increased dose compared to Pfizer. It might be a bit better against BA.1 and viruses that look like BA.1 compared to the Pfizer ones. The Pfizer one might be a bit better against 4/5 and the ones that look like that. But basically, when we're looking at the animal studies, the immune response for those BA.1 bivalent and the BA.4 bivalent, when we looked at Moderna, was basically the same. So I can understand people who are having sort of the conditions, but it's basically, if you're 6 months out, get your bivalent, get whatever bivalent you can get. If you are 3 months out from a dose of vaccine or COVID illness, then consider getting the bivalent. And again, that will depend on your individual biological risk factors and what you might be doing in the next while. We are starting to see an increase in cases. We are heading into the fall season. There's a lot of gatherings and festivals that are happening as well. So we know that there's going to be increasing circulating virus. So again, if you're in that time period, if you are less than 3 months, I would not advise you at this point in time to get a booster. And it's not because of a safety reason, but because the effectiveness of that booster is likely not going to be as good as if you got it after 3 months. So that's kind of the advice that we would be giving now.
Yeah. So I would just reiterate, certainly from a public health perspective, they're both, Omicron containing, sort of a variant of vaccines, and therefore, certainly, if you go out, I think whatever's offered to you is certainly what's available at the local level when you go for your appointment to get a bivalent vaccine booster. I would take whatever's offered.
I'm also curious, I believe that Pfizer had also submitted a BA.1 bivalent vaccine. I don't think that one's been approved. Has that been dropped now? Are we still considering it? And sort of double barreling my question, do we feel like we've sort of caught up to the variants now with the BA.4/5 since those are the dominant variants circulating?
Yes, we do have a Pfizer BA.1 bivalent under review, and it was basically completed in terms of the Health Canada portion of the review. There's a lot of activities that go into the finalization of a review at the end in terms of labeling and other administrative sort of things. Pfizer at this point in time said they could basically support one or the other. And we looked at which one would likely be the one that would have the most uptake, and that was 4/5. Just to say that all the data that we looked at for the BA.1 bivalent is something that we actually incorporated into and was part of the supporting data for the BA.4/5 bivalent. So now that we finished the BA.4/5 valent, and once that gets rolled out, we'll go back and complete the BA.1 as well. But there's a question about how much interest there will be in terms of uptake on that. And sorry, your second part of the question was?
Just have we sort of caught up to the variants?
I think we're in an interesting kind of place in the pandemic where we haven't been before. There's a bit of a variant soup out there. There's lots of different ones. It's still a little bit uncertain which one might emerge. I think, the vaccines that we have now protect us very well against the circulating variants that we currently have. There is some evidence that at least some of the top candidates for the ones that might emerge in the next wave would be covered by these vaccines. But I think it's, we're still learning as we go with the pandemic, and we're seeing still a lot of, as we said, mutations and variants come out. So it's a little bit challenging to see what the future holds. But certainly Omicron has been the one that has had probably the most staying power of all the different groups of variants, and the ones that were emerging seem to be in that area. And so that's why the bivalent Omicron bivalent vaccines as boosters are likely to offer better protection than the originals.
And I could add a little bit to that as well from the perspective of NACI and the advice they provided today. In terms of immunization strategy, the committee is clear that the goal of this fall program and using bivalent boosters going forward is to increase the breadth of the immune response, not necessarily to try and get the closest match to the strain of today or the best fit. The goal is to increase that breadth, and we know that both the BA.1 and BA.5 are Omicron variants, and Omicron is very distinct from the original strain of the virus. So that stretches the immune response, provides that breadth and that diversity that should hold us in good stead going forward. So that's a bit of their perspective around the strategy of the program for the fall.
Thank you. So we'll now go to Zoom. If you have a question on Zoom, please use the raise hand function, and we'll start with Glenn McGregor from CTV.
Hi, thanks for taking my call. The drive to get more people booster shots has not been a rip-roaring success. I think the last time I checked, you were at somewhere around 15% for people for getting their second booster. And now you're asking people to get another one. In some cases, this could be people's fifth shot. Do you have a projection of how many people are actually going to get this shot?
It's Dr. Njoo. Maybe I can respond to your question. Certainly, as we've gone through this pandemic, we're always learning in terms of not just from the scientific perspective, in terms of what vaccines work, in the formulation, but also in terms of behavioral science. So I think what you're getting at is in terms of vaccine confidence and vaccine uptake, and in small part also maybe some issues about vaccine hesitancy. So we're very alive to that. We have lots of experts behind the scenes looking at what different ways or what ways we can reinforce in terms of giving the right information, not just to the average Canadian, to be quite honest, but also to healthcare providers, community leaders are using multiple platforms, so that people at the end of the day can make hopefully an informed decision as to why it is important, and it's good to keep up with your vaccination. So that's all I can say. And the modeling, I think in some ways, you can take sort of the here and now, but as we continue with our efforts to improve vaccine confidence through a variety of means, we certainly anticipate that we will increase and improve uptake.
But are you not seeing a different problem than vaccine hesitancy or lack of confidence in the people who were nervous about getting vaccines initially? You're now seeing people who have had vaccines, their first 2 shots, and maybe an additional booster, but are now saying, I'm not going to go in there for a 5th. That's a different kind of problem.
Yeah.
I'm wondering how you're going to address what looks to be more like vaccine fatigue rather than hesitancy.
Yeah, it's actually, you're right. It's a good point in terms of, you mentioned vaccine fatigue, and you're right. In the early days, certainly when the first vaccines came out, certainly everyone was thinking, said, okay, let's say, the term fully vaccinated or getting sort of the 2 doses of a primary series was the way to go. And then we were thinking about, sort of herd immunity with, to be quite honest, at the time, not knowing initially what sort of the longer protection might be. Now we're all learning, and the fact is that certainly what we've seen from the worldwide experience, as well as here in Canada, is that the immunity wanes with time, and that's natural, normal for many vaccines and infectious diseases. So now, with the latest evidence we have, we recognize that it is about 6 months being the limit, and I think we're now changing, in terms of updating, informing Canadians that, hey, in some ways, I'm not saying it's a perfect analogy again, but take the case of influenza vaccine. I think people have now been socialized and, sort of are aware that, hey, influenza vaccine, it's not sort of a one and done kind of deal in terms of getting vaccinated, that you need to do it on a regular basis. In the case of influenza, it's sort of an annual basis, more into the fall. And we just mentioned about getting your flu vaccine this fall as we head into the winter respiratory season. And I can anticipate that, our sort of education or awareness campaigns for COVID-19 vaccines may be aiming in the same direction, saying that, we don't know what the rhythm might be or the sort of what a regular sort of getting updated in terms of a COVID-19 vaccine will be, based obviously on sort of the ever-evolving evolution of the virus and mutations. But I think that's where we're heading. And I think Canadians, by and large, will get that. So you could say, yes, there is vaccine fatigue in terms of what we've been through for the past 2 years. But I think as we try to head back to what we might call a more normal or new normal in terms of how we manage COVID-19 moving forward, my anticipation, hope is that people recognize that compared to many other infectious diseases, we've learned a lot from COVID-19, and maybe the way for the future for vaccination is that there is this idea that there needs to be sort of a regular sort of a rhythm or getting up to or keeping up to date with your COVID-19 vaccine.
Okay, we'll next go to Olivier Ferrand-Boisset from TVA.
Oui, bonjour. Je me demandais si vous aviez des données sur le pourcentage, sur l'amélioration en pourcentage de la protection démontrée par ce vaccin-là bivalent chez les humains par rapport au précédent. En gros, comment la compagnie a démontré la valeur ajoutée de ce vaccin-là?
OK, c'est Dr. Njoo. Peut-être je peux tourner à Matthew Tunis, il va répondre en anglais, mais je pense que, Il y a toutes sortes de données probantes concernant les deux vaccins bivalents. On a aussi des essais cliniques concernant le BA1 et pour le BA4, 5, on utilise des autres données probantes, mais je peux tourner vers Dr. Tunis pour élaborer.
Oui, merci. So if I understood the question, it was about the increased protection, the increased effectiveness of this new bivalent product. And I'll defer to Dr. Sharma, but the comments, what was outlined from NACI in their report and their analysis, is that most of these assays were antibody assays, and so you do see increased neutralizing ability to neutralize Omicron variants in the bivalent products. Can't make direct comparisons between the BA1 or the BA5 products because they are were studied differently, different assays in different environments, but there are not clinical effectiveness data that would be able to give us a percentage of how much more protective we expect BA5 to be than the boosters that came before. But all the indications from the laboratory assays that were studied suggest that there would be some increased neutralizing ability of the antibodies, and then we would assume some increased protective ability. But Dr. Sharma, did you want to add anything on that?
Sure. So the way that we do these types of bivalent studies is that you look at the comparison between the new vaccine and you compare it with the original sort of strain. And so what they have to be able to demonstrate is that, so if it's a BA1 vaccine, that they actually have a better immune boost than the original against BA1. If it's a BA.4/5, they need to have a better immune boost compared to those viruses than the original. And so this BA.4/5 showed an increased level of what we call neutralizing antibodies. So those antibodies that come up right after you have your vaccination against BA2, BA.4, and BA.5. They're about the same against BA1. And there was a significant response. It's difficult to actually say a number better than the original because, again, these are animal studies and they are just looking at neutralizing antibodies. And there's a whole other part of the immune system that gives you sort of more lasting immunity. But really, that's what it showed, is that there was a good immune response and it was better against these Omicron variants than it was compared to the original. And just to say that the bivalent vaccine, as a reminder, is bivalent, so bi for 2, and it has both the original strain as well as the Omicron specific BA4, BA5. For the Moderna one, it has both the original strain as well as the vaccine against BA1.
Oui, merci. Pour mon suivi, j'aimerais vous entendre sur l'approche d'un autre pays, le Danemark, qui n'offre pas de dose de rappel aux personnes de moins de 50 ans, n'offre plus la vaccination pour les moins de 18 ans, parce qu'on dit dans les deux cas qu'on est moins à risque de développer des maladies plus graves. Bref, je me demandais comment vous expliquiez la différence si grande entre les approches d'un pays comme le vôtre et comme le Danemark.
C'est Dr. Njoo, je peux commencer, puis je vais aussi tourner vers Dr. Tunis. Je pense qu'effectivement, chaque pays a leur propre, comme dit, évaluation, aussi leur comité, dans notre cas, le comité consultatif national de l'immunisation peut donner les meilleures recommandations selon les données probantes scientifiques aussi, mais ici pour le Canada, dans le contexte du Canada. Moi, je ne peux pas prononcer c'est quoi les discussions, qu'est-ce qui se passe en Danemark, mais ici au Canada, on fait qu'est-ce qui est mieux pour les Canadiens et Canadiennes. Mais maintenant, je vais tourner vers Dr. Tunis.
Merci. Yeah, I mean, I think Dr. Njoo captured it well. Every country has a unique context. And so we know that the immunization program decisions that are made by different countries would consider both the products that are available to them and authorized in those countries, and also the the history of the pandemic to date in that country too. So levels of seroprevalence, how many people have already been infected, those can also factor into thinking at times. And we do see a diversity of approaches across the world right now with fall booster campaigns. For example, in the US, they are using largely the BA.5 boosters. In the UK, they're using largely BA1 and original. And in Canada and Germany, you're seeing the bivalent products be preferred overall. So we do see a diversity of approaches. And that's not unusual because there are so many factors that would go into any decision-making for any given country, which, as I mentioned, include the epidemiology, the context, the vaccine uptake and vaccine history in that country for this program so far. So it's really hard to draw direct comparisons, but what's outlined in the latest expert advice is that, yes, in fact, we do still see hospitalization rates and disease rates among populations under 50, for example. And so NACI does recommend that boosters may be offered for those 12 to 64 with the bivalent product. So we're going to continue seeing diversities across the world, and we shouldn't be expecting to see harmony. We don't expect that with most immunization programs. Every country has a unique context.
We're going to come back to the room. Stephanie Levitz from the Toronto Star.
Good morning. Dr. Sharma, I wonder if I could ask you about something else, and that's the current shortage of infant Motrin, Tylenol, ibuprofen products. And if you're able at all to sort of address the steps that Health Canada seems to be taking to deal with that shortage, and what advice perhaps you or Dr. Njoo have for parents? We have anecdotes of people using expired products for their children, trying to tweak adult products to fit an infant formulation. So I was hoping you could address that.
Sure. So in terms of the shortage that we're seeing, where people are seeing difficulties obtaining both the acetaminophen and the ibuprofen products for children, this has been something that's been going on since the summer. And just to give you a bit of the background, what happened was that there was an increase in that utilization over the summer. These are seasonal products. Manufacturers produce them in certain quantities, and then there tends to be an uptick in the fall sort of season. Usually utilization is lower in the summer. It was increased, potentially because of some increase in viral illnesses, but there was also a lot of attention to the issue, and we could see an increase in uptake when that attention was there. And I think we all lived through the beginning parts of the pandemic when there was runs on toilet paper, for example. So I think there is a certain extent, there's some panic buying there. And I can understand that from a parental point of view. They want to make sure that they have products available to treat fever and pain. So, but what we've done is that we've worked with manufacturers. There are some manufacturers that are now manufacturing at double or triple what their normal volumes would be for Canada at this point in time. We're exploring other options, whether or not there are other sources, other countries that might have product available. There tends to be an overall, a bit of a tightness in the system across the board, but we're looking at that as well. But the other part is that we really want to make sure that people are only getting medication, buying medication when they need it. I know that there's a tendency to make sure that they have medication there just in case, but it's leading, as we said, is to some panic buying out there. And when we look at the buying in Canada compared to other countries that are very similar, so that have similar patterns in terms of viral illnesses going up, Canada seems to be using or buying more of the product right now. So I think part of it is just to say, we don't panic. There is more product coming in. As we said, manufacturers have increased their production. We expect to get more product in, especially for hospitals over the next little while, but also in the community. So that's the first part of it. Then the second part of it is in terms of advice. I think first of all, fevers as a symptom of usually an infection in children. It's usually viral. It's usually harmless. So I think it's one part of it is that not all fevers necessarily need to be treated. If you have a child that's 3 months of age and younger, then that's something that you should be concerned about. You should see a healthcare practitioner. If you have a fever that's very high, that's persistent, you may want to see your healthcare practitioner. But you don't necessarily have to treat it. There are alternatives, whether it's cold compresses or for pain, you can use warm baths and things. There's other things that you can do as well. But also, as we just go back to it, is to not purchase products from sources that are not credible. So online, only from credible sources. We would recommend against using expired products, and it's not because automatically on the day after the expiry that it won't work or it's dangerous, but we just don't have data to support how stable those products are in the longer term. If you are using adult preparations, and maybe using the powders and putting it in jam or yogurt or something, just be very careful about the dosing, especially for acetaminophen, because it's very easy to overdose on acetaminophen and cause liver injury, especially in younger children, more so with acetaminophen than with ibuprofen. So if you're doing any of that, then I would consult a pharmacist to make sure that that calculation is being done appropriately. You can also go to compounding pharmacies, and they will be able to make up preparations. It may not be exactly the same flavor, but they can compound specific doses. They have a specific shelf life as well. So there's lots of things that can be done as well. But I think the major point is that we just need to be very careful about sort of the panic buying at this point in time. And I, again, totally understand the anxiety of having a screaming child in the middle of the night with fever or pain. But I think this is when we have to, again, look collectively at that supply. And it is there. It is coming in. There are alternatives. And we will get through this next period of time if we all work together.
Yeah. It's Dr. Njoo. The only thing I would add to what Dr. Sharma has said is that, obviously these medications continue to be over the counter. I think there was maybe some misunderstandings or so previously that it had to be by prescription. So it's still over the counter. And really, in terms of best practice, if a parent is wondering, not sure what to do, I think really, as Dr. Sharma indicated, speak to a healthcare professional, because in terms of the actual individual context, what could or should be done to obviously manage, be it pain or fever for our child, is best managed by speaking to someone who actually can give you the best advice on the ground.
And then just as a follow-up, some people have suggested that one of the ways we could alleviate the shortage is to allow for the importation of foreign language labeled products similar to what's been done in other situations in the past. Is that something you're actively exploring? Why or why not?
So that avenue is already open. So I know I've heard some of the discussions about having a new framework, but the Food and Drugs Act and the regulations already allow for critical medications to come in. We also have something that's called compliance and enforcement discretion. So we can bring in product. Obviously, we want to make sure that the product is as close to a product that's already authorized either in Canada or elsewhere, and that it's reliable and it's safe and it's effective and it's of high quality. And then if a foreign product is coming in, we want to make sure that there is a provision to have some sort of information around directions for use and safety information in both official languages. And there's a variety of different ways to do that. So that's an avenue that's already open. We've spoken to manufacturers about the possibility of using that pathway. It's a matter of having supply that they can then provide. But there's no barriers from a regulatory perspective in terms of bringing foreign product in.
Thank you.
I think Emily Bergeron has another question in the room.
Yes, thank you. Je voulais savoir, Dr. Njoo, est-ce qu'on a une idée à quel moment les premières doses du nouveau vaccin qui est approuvé aujourd'hui, à quel moment ils vont être disponibles dans les centres de vaccination et dans les pharmacies?
OK, merci beaucoup. Ce que je peux vous dire maintenant, si on parle de le vaccin de Moderna, le BA.1, actuellement, on a 10,5 millions de doses ici dans le pays. Et si on parle de nouveaux vaccins de Pfizer, on attend, même la semaine prochaine, on attend les livraisons des doses. On attend, je pense qu'on a un contrat pour 12,6 millions de doses. Et je pense qu'au fur et à mesure, chaque semaine, on va recevoir quelques millions de doses. Et en total, c'est 12,6. Et entre les deux, je pense que c'est assez pour la demande prévue pour les doses de rappel.
Merci. J'avais une autre question. Il y a l'un de vous, je ne me rappelle pas lequel, a dit que on ne sait pas encore à l'heure actuelle s'il y aura un besoin d'avoir constamment une prochaine dose à chaque 3 mois. Donc, il n'y a pas de décision sur la routine de cet exercice-là. À quel moment environ, ça pourrait prendre combien de mois avant qu'on ait assez de données pour savoir si ça va être nécessaire d'en avoir à chaque 3 mois ou 6 mois?
Yeah, I can respond to that. So you're right that in terms of the immunization strategy, NACI has recommended that we do not need to be prepared for a routine every 3-month program. And I think Dr. Njoo previously commented that everyone is very eager to have a more predictable cycle for COVID-19 boosters and programs. Doesn't seem like we are quite there yet. I mean, the fall program is a step towards some predictability, but it remains to be seen, how the epidemiology will unfold with new variants, et cetera. Generally, it has been taking several months from the launch of a new vaccine to accumulate enough evidence to be able to ascertain vaccine effectiveness estimates. So to understand how well the vaccine actually performs in the real world has been taking somewhere between 2 to 4 months generally after the launch of those programs, I would say overall, so far throughout the pandemic. So I think we could anticipate that within several months, we will start understanding vaccine effectiveness, real-world evidence to see the performance of the product. And then over time, that can be monitored and measured against the emergence of new variants, and all of those considerations will have to factor in. We understand that the manufacturers are continuing to consider what the forward path for their products will be, and if they might generate new boosters, that's still a bit unclear. So I think there will be probably regulatory frameworks that will emerge, and Dr. Sharma could maybe comment on that about, regulatory frameworks around future cycles for other booster products. But at this point, we're a bit in a wait-and-see space. We are launching this fall program, and then we'll monitor over time. But we don't anticipate routine every 3 months. It's not a sustainable immunization program model. It doesn't exist in any other areas, and it just doesn't seem like a realistic program. So although there are some exceptional circumstances where these shorter intervals may be necessary, we're going to be looking towards some kind of a more sustainable approach. And so NACI has been clear in their advice on that we'll have to keep watching and develop some more sustainable long-term framework.
Bon, c'est Dr. Peut-être aussi ajouter quelque chose en français. Si on regarde qu'est-ce qui se passe avec la COVID-19, pour beaucoup de moi aussi, c'est wow, c'est comme une éternité, mais ça fait déjà peut-être 2 ans et demi, presque 3 ans, avec notre expérience collective pour la COVID-19, et on a beaucoup plus d'expérience avec les autres maladies infectieuses comme la grippe, la saisonnière. Donc, je pense on est en train encore d'apprendre, de continuer de suivre l'évolution du virus. Et c'est ça, oui, peut-être au futur, on va trouver une rythme peut-être pour une dose de rappel pour un vaccin contre la COVID-19, peut-être semblable à l'influenza. On ne peut pas dire que ça va être exactement peut-être le même rythme de toutes les années, mais on voit même cet automne, c'est bon, c'est efficace pour les programmes de vaccination, mais aussi c'est bon aussi pour les personnes être capables d'aller pour un rendez-vous à recevoir les 2 vaccins en même temps. Je ne sais pas si c'est quelque chose qui va être comme c'est une rythme normale au futur, mais je pense que on continue d'analyser toutes les possibilités pour le futur. Mais pour l'instant, c'est comme Dr. Tunis a dit, c'est oui, le 3 mois, c'est comme peut-être une limite basse, mais la recommandation en général, c'est au moins, c'est 6 mois, sûrement. C'est important de recevoir une dose de rappel, mais avec les autres circonstances, on peut peut-être aussi offrir un vaccin bivalent comme dose de rappel après 3 mois. Mais c'est pas comme une politique, oui, c'est sûr que tout le monde doit profiter de ça. Merci.
Okay, I think that concludes today's press conference. Thank you very much.